Hi, how are you today?
I'm good. How are you?
I'm good. I'll be your nurse today. My name is Hannah. I'm going to practice my hand hygiene and do patient privacy. Can you confirm your name and birthday for me?
Lindsay Johnson, 10/16/2000.
Awesome, Miss Lindsay. I'm going to palpate your head, feel for any abnormalities. And I'm going to come back here and feel for those lymph nodes. And then I'm going to come down the trach and feel the thyroid. Can you swallow for me? Good. I'm going to come up to your face and palpate for the sinuses. Good. Alrighty. Can you rotate your neck for me? I'm going to feel for the carotid artery and look for jugular vein distension. If I had an otoscope, I would look into her ear, but since I don't, I'm just going to observe the outside. Looks good. Can you go the other way for me? And I'll do the same thing. Feel for the carotid, look for the jugular vein distension, and look in the ear. Good. Now I'm going to check your pupil reactiveness. Can you look at me? This will be a bright light. Good. Good. Now I'm going to shine it again in this eye and check the reactiveness of your other eye. Good. Can you follow my light for me? Good. While I have my light, I'm going to look up the nose. Look for the mucous membrane, see if it's pink and moist or dry and pale. Can you open your mouth for me and stick out your tongue and say, ah? Good. I'm looking for the same thing, mucous membrane and soft palate. I'm also looking for any cavities or dentures. Can you wiggle your tongue back and forth to check that cranial nerve? Good. Alrighty. Now I'm going to take my stethoscope and listen to your heart. Good. And I'm going to go the fifth intercostal down and listen to the apical pulse. Good. And I'm coming to the side and hearing the side. And I would listen to all of these for 60 seconds. And since I have my stethoscope out, I'm going to come to the back and listen to those lungs. Take a deep breath for me. Good. Another one. Great. Two more. And last one. Good. Since I have my stethoscope, I'm going to shake the bell and listen for that carotid for another 60 seconds on both sides. Good. And since I do have my stethoscope, I'm going to ask her to lay down and listen to all four quadrants of the stomach for 60 seconds again. Good. Now I'm done with my stethoscope. I'm going to palpate the stomach and all four quadrants. Lindsay, do you have any pain or tenderness when I press down?
No.
Good. When was your last bowel movement?
This morning.
Was it normal, loose?
Normal? Yep.
Awesome. And I will percuss if needed. Alrighty, you can sit up for me. And since I am on her backside, I will check for any skin integrity, any skin tears. I will check that coccyx and look underneath the arm, the elbows, and the wrist, both sides. Good. Since I am standing here in front of you, will you pull away from me, push, good, and squeeze my hands. Good. Now I'm going to palpate down the legs and check for any edema. I'm going to feel for the posterior tibialis pulse and then the pedal pulse. Good. Can you pull up towards yourself? Good. And push down like you're driving a car. Good. I will check for capillary refills, how many seconds it takes from going white back to pink on fingers and toes. And then I will feel for the brachial pulse for 60 seconds. Make sure they're strong, not weak, and equal. Then I'll go down to the radial pulse and do the same thing. Okay, and that's it. But before I do that. Before I would have done the physical assessment, I would have made sure that I have consent, and then I will wash my hands again. And
Thank you.
thank you. Have a great day.